So in this mini tutorial we're going to think about the concept of immunological barriers, and what we mean by this is the physical barriers in the body which stop pathogens from crossing from the environment into the inside of the body itself. And to help us think about this, I'm going to draw a little cartoon man here. So here's our little cartoon man. Apologies right now for the poor quality of the drawing, but here's our cartoon man, and we've drawn the outside of his body there. He's obviously standing in profile. There's his eye. This is his digestive tract here, like this. And the reason I've drawn this man like this is because I want you to realise that there are some parts of the body which, even though they are internal, are still technically in direct contact with the outside world. So, of course, the skin on the outside of the body is in direct contact with the outside world. We can understand that as a barrier. But you'll also notice from the way I've drawn this very simple cartoon that the gut, the gastrointestinal tract, is also in direct continuity with the outside world, and therefore the lining of the gut itself must act as an immunological barrier. If we still can't quite grasp the idea that the gut is in direct continuity with the outside world, I want you to just imagine if a little ant crawling along the surface of our cartoon man's body, and you can actually imagine, can't you, that that ant could crawl in through his mouth, go all the way through his gut, and then crawl out through his bum. So the gastrointestinal tract is in direct continuity with the outside world. Now, any surface which is in contact with the outside world needs to have a functioning immune system associated with it. That, of course, is going to include a physical barrier function, and there's also going to be various cells and molecules within those tissues to prevent the passage of pathogens. So let's start off by thinking about how does the skin act as a barrier against pathogens. So we're going to zoom in on the skin. It could be skin on any part of the body, but let's think about the skin. And if we draw a very quick picture of what the skin looks like, the skin is an epithelium. In fact, all of the surfaces which we've drawn in this cartoon are epithelia. And as you should know from Dr. Hutchins' lectures, all epithelia have a basement membrane, and attached to that basement membrane are cells. Now, in the skin, there are many, many layers of cells. So the skin is a stratified epithelium. Okay? And these cells are joined together very strongly by desmosomes, and also the cells release a number of lipid-like compounds which are involved in waterproofing of the skin. Now you can see that these multiple layers of cells in our skin means that if a bacterium wants to get in and across this barrier, which is the skin, it's going to have a really hard time, because not only is it going to have to pass through multiple layers of skin cells, but it's also going to have to pass through all of the intercellular junctions between those epithelial cells in the skin. Additionally, there are immune cells within amongst all of these skin cells, which are constantly surveying the skin to see if there are any pathogens trying to get in there. If our bacterium, which we drew here, were to get across the basement membrane of the skin, then of course it would have made its way into the body, and it would have got across that barrier, and it could therefore cause infection. Now let's think about the nasal cavity as an example of an immune barrier. So we're going to think about the nasal cavity, the nose itself. Now, the epithelium lining the nose is very, very interesting indeed. This is an epithelium which has just a single layer of cells, and the cells are kind of cuboidal in shape like this. And these cells possess cilia, and the cilia all beat in the same direction. And if you find cilia in the nose and the nasal cavity, they all will beat backwards. Okay, so the cilia in the nose beat back towards the back of your throat. However, the cilia in the trachea, in your windpipe, they'll beat in the opposite direction. They beat upwards. And the reason for this is because ultimately you want all of the mucus which is on the surface of these cilia and which has trapped pathogens to ultimately get into the stomach. So you waft the mucus backwards through the nasal cavities to be swallowed, and you waft the mucus up through the trachea to be coughed up and then swallowed again. Now, there are diseases whereby patients have cilia which do not move. And in fact, in the embryology lectures, we did consider one such disease called cartilaginous syndrome. And in that disease, the cilia are immobile, they don't move. And as you can imagine, this predisposes these patients to respiratory tract infections because they're not able to clear all of the pathogenic material from their airways. Another extremely interesting surface to consider as an immunological barrier is the eye. So if we quickly draw an eye here, alright, so here's an eye with some eyelashes. There's an iris with a pupil in the middle. Here is the nose. Tears are actually produced in the lacrimal gland, which sits up here, but they're drained down through a system of canals which sits just here. So you can imagine that the tears being produced up on the lateral side of the eye actually wash across the eye like this, in this direction. And they're constantly washing tears across the surface of the eye, clearing bacteria and viruses that might have gotten onto the surface, the conjunctiva of the eye itself. Then all of those tears drain down through this canal, they get into the nasal cavity, and then follow the same path that mucus in your nose would take, i.e. back towards your throat to be swallowed. Finally, if we consider the gut, the gastrointestinal tract, as we said, this is in direct continuity with the surface of the body and is therefore an immunological barrier. It is lined also by an epithelium, and as I'm sure you know, the surface of the gut is thrown into folds, these folds being called villi. Okay, you can hardly see them under the naked eye, but they're there. The villi themselves are covered with epithelial cells, cuboidal epithelial cells. So those cells, along with their basement membrane, form a barrier. And remember that these cells in the gut have got tight junctions between them which prevent passage of substances in the gaps between the cells. So it's very difficult for anything to get in between cells in the gut, and very difficult for any pathogenic organism to pass straight through cells. So that's a very effective barrier, even though it's a single layer of cells, due to the fact that there are tight junctions. And also something else to note is all along the gut, essentially from your mouth to your anus, all along the gut, sitting underneath the villi, are these big regions of lymphoid tissue. So these are aggregations of immune cells, and you can just imagine, can't you, if a pathogen is able to pass across that barrier in the gut, it will very rapidly hit this aggregate of lymphoid tissue and be dealt with very quickly. Okay, so that concludes our very brief discussion of immunological barriers.